What is the role of science in shaping public policy? Over the last several decades, there's been a discussion about the concept of technocracy, mainly that public policy could be dictated or mandated by technical knowledge and technical experts. This has taken place mostly within the context of global warming and climate change type policy. But over the last several years, people have had these same discussions related to COVID-19 policy. They're asking questions like, what does science tell us? What is the purpose of science? And can science dictate and mandate policy, or is it simply one means that informs policy? A common phrase that's been said in the media is follow the science. And here we see some examples. From The Economist, 3 different articles all saying the same thing. Are governments following the science on COVID-19? Follow which science? Dr. Fauci, follow the science. From Bloomberg, Biden's day 1 assignment, order the government to follow the science. From News and Focus, which is the academic publication Nature's popular press, has Biden followed the science? What researchers say. From the New York Times, Biden promised to follow the science, but sometimes he gets ahead of the experts. And from Stat News, Biden pledged to follow the science, but experts say he's sometimes fallen short. Over the last 2.5 years, I began to ask myself the question of, does science mandate policy, or is it simply one means or one type of knowledge that influences or informs our policy? And over the last 2.5 years, I've become very interested in this question. I've read over 15 books, hundreds of articles, and listens to hundreds, perhaps thousands of hours of audio of people debating this and similar topics. And over the last 2.5 years, I've become increasingly convinced and passionate that follow the science is a phrase that we should use less and less. And so today I'm going to be discussing my opinions with you through our title, Follow the Science, a Critical Analysis, and the role of science in COVID-19 public policy. So I have no financial disclosures, but I want to be very clear. While I'm advocating about a particular way in speaking about policy and technical knowledge, I'm not actually advocating for a particular politician, political ideology, or policy plan. So if you've used these words and I've disagreed with the way maybe that we're speaking about them, it's not necessarily that I'm disagreeing with what you're proposing or, a favorite politician, but really the way that we're speaking about them. Agreeing upon information is important, and this talk will not speak about people, trying to deny scientific facts or ignore scientific facts, which could be a whole separate discussion in and of itself. And then finally, essentially all of these ideas are based off of mainstream academic sources, and the few opinions contained wherein are my own. So I'm going to be making the case 3 separate claims about follow the science and its associated rhetoric. First, is there any way that I can minimize this thing up top?
You open the chat and then close it. It should.
Open, okay, and then close it. Okay. So that scientific knowledge follow the science conflates scientific knowledge with non-scientific claims about best action and appropriate policy. 2, that follow the science fails to identify specific scientific claims, and it fails to recognize the multidisciplinary, integrative, and democratic nature of public policy. And then finally, that follow the science runs the risk of negatively impacting the public perception of science, public health, thereby undermining the entire intent behind using the words follow the science. So we're going to explore 3 main objectives today to explore those 3 topics. First, we'll define science. Second, we will list components of COVID-19 related public policy and look at sources of information used to derive policy. And finally, we'll examine the impact of follow the science and associated rhetoric on the public's views of science and public policy and public health more broadly. So first, let's start by defining science. What is science? It's a very simple question with a very complicated answer. Similarly, if I ask you what is love, you might have some gut intuition about what it is, but you might have a very difficult time articulating it. And it turns out that the public impression of what they say when they mean science is quite different than what philosophers or scientific advisors mean when they say science. So in Pew Research studies, most people, when they are asked, what do you mean by science? They say medicine or technology. And that's actually not necessarily true of science, as we'll see in a few minutes. So how do we know what science is? There's actually 4 related academic disciplines that study science itself. They are the philosophy of science, which asks the question, what is science? What is the purpose of science? There's epistemology, which is the study of how we know what we know, that in the context of science asks the question, what are the limits, scopes, and strengths of scientific knowledge? There's the history of science, which explores how science has changed over time and the contribution that it's made to society. And finally, there's the sociology of science, which explores communities within science and incentive structures of scientists. Prominent philosophers of science throughout the course of time include people like John Locke, David Hume, Immanuel Kant, Karl Popper, Thomas Kuhn, and Imre Lakatos. So let's talk a little bit about modern day science and what most of us think of when we use the term science. It's derived from a Latin word, Whitney's favorite language, scientia, which means logically demonstrable knowledge. However, that was often used in the presence of geometry when you think about geometric proofs. And science got its name because physics was really the first science that was derived, and it was heavily math-based. There's a broad use of science that people use in everyday language. In the context of broad use of science, science really isn't different than things like common sense. So in this use of the word, science was present basically in all human civilizations and in most human endeavors like farming, so agriculture, architecture, etc. And when people say science in this term, they really mean observation and evidence derived from observation. But most of us, when we use the word science, are meaning it in the narrow sense of science. And we are talking about our particular way of examining the world or examining nature that started during the scientific revolution in the mid-1500s. Early on, science wasn't called science. It was called natural philosophy when it explained the causes in the natural world, or natural history when it worked on describing the natural world. The first science that arose in the scientific revolution was physics. It's people that you might have heard of, people like Copernicus, pictured on the right of the screen, Galileo, Kepler, and Newton. Over time, science began to expand, and by the mid-19th century, included fields like astronomy, biology, and anatomy. Science was wildly accurate and wildly successful at explaining the natural world, and then being converted to things that could help the human population. And over the course of time, people became so settled that science was a great source of knowledge that they became very interested in asking what separates science from non-science, because science is so trustworthy that if we can understand criteria to separate science from non-science, then we can know what is fact and what is opinion, or at the very least, what is a fact that we can trust and what is a fact that might be a little bit more subjective or less ironclad. And that's when we enter into what's known as the demarcation problem, which has been debated for sure over the last century, but over the last 3 centuries. People ask questions like, what makes a theory scientific compared to a non-scientific theory? How can scientific theories be distinguished from non-scientific theories? Does all the work that we call science have much in common at all? Or is this really a broad array of disciplines with an umbrella term? Is distinguishing science versus non-science actually helpful? Or should we just talk about the specific methods and the strengths of every particular argument? So over the next couple of slides, we're going to look at 5 criteria that people have proposed to demarcate or differentiate science from non-science. And we're going to see that each individual criteria failed. But we get to see that it's very helpful to know some of the factors or some of the variables and some of the features of science that people have proposed throughout the years. These are the most philosophically dense slides. And once we move past that, we'll summarize it and move on. Remember, scientia was derived from a word that meant confirmable knowledge. And so early on, people said what differentiates science from non-science is that science is certain and it's confirmable. It's logically demonstrated. It's an absolutely certain truth. On the right of the screen is a picture of deductive logic, which is more familiar in algebra and geometry, like x equals y, y equals z, using the deductive or the transitive property of equality, x equals z. That's a logically demonstrable proof. Not logic like in the sense of common sense, but logically demonstrated like like a logician. But most science isn't deductive. It's actually inductive, where you look at a series of cases and try to predict what happens in the future, predict a common theme, or predict what happens in the past. Thus, it's not able to be logically demonstrated or confirmed. Most science works on predicting what's going to happen next, and there's uncertainty in prediction. When we confirm theories, we don't confirm them anymore with 100% certainty. Over the last 100 years, we've started to apply statistical methods, and we've had the p-value come to light, which is basically the percent confidence that you can reject the null hypothesis, right? 0.05, 0.01. So actually our confirmation of theories that are scientific is probability based and not certainty based. And then as we know from looking at the history of science, science changes and it builds on itself. It can refute prior science or it can build on prior science. So this is the only criteria that was actually rejected. And it's been replaced with the criteria of science that says science is provisional, probabilistic, or progressive. Next, they said methods. Certainly the scientific methods differentiate it from non-scientific methods. When we were young, we learned about the scientific method. More recently, however, thanks to ongoing discussions about the scientific method, scientific textbooks are decreasingly including the scientific method in those textbooks. Why? Because philosophers of science agree that there's multiple competing methods that fall under the scientific umbrella. Some methods predict, whereas some explain. Some are theoretical, describing non-observable proposed entities, where some are directly observable and empirical. If you compare physics to biology and anatomy, they have massively different methods, and they don't all take the same approach, even though they are all systematic in some sense. So while there seems to be something unique about the replicability, testability, and potential variable manipulation, there's not a lot in all of science that's similar for methods. Next was observation, and this is kind of funny. So the logical positivists were a philosophy and linguistic group who made the claim there's really no such thing as science. There's observable knowledge and non-observable entities. But observable knowledge can be known. Anything that can't be observed cannot be known. That was their claim. But it's interesting, if I tell you only observable entities can be known, can the claim that only observable entities be known be observed? It's like me telling you, don't trust a single thing I say, or there is no such thing as truth, or words have no meaning. It's self-destructive, it's self-defeating. The other thing about that claim is it leaves no room for theoretical entities. When bacteria was first postulated, people couldn't observe it, but they postulated it. And over time, the theory was translated into the practical when we could observe it and the empirical. And science has had a lot of success using theoretical entities and non-observable entities like mathematics. Next was the criteria of falsifiability. Well, maybe if we can't confirm science, maybe if it's progressive, provisional, and maybe if we try to predict what's going to happen, maybe we can say if we can falsify it, then it's science. But is every statement that's falsifiable scientific? Consider if I said my toothbrush is in the bathroom, that's falsifiable. It's true or false, but it's not science. What if I said my toothbrush is flying around on its wings? That's falsifiable, but it's nonsense. Theories often have multiple different components, and so you don't reject or accept an entire theory based on rejecting or accepting one small component, and that's an idea called holism. And oftentimes, when we ask scientific questions, we're asking open-ended questions that may not be falsifiable in and of themselves. We might ask, what's the transcriptome change, in a particular cell type or a tumor? And finally, they said experimentation, or the manipulation of variables. And again, there's open-ended questions in science. There's also human endeavors where we manipulate a variable that's not scientific. Let's say I bake 2 batches of cookies and change the sugar in one of them. I'm manipulating a variable, but we don't consider that science. And so over time, we've explored 5 different features of science, and we've seen that none of them is a perfect demarcating criteria, but all of these start to give some sort of shape and void to what historians of science, philosophers of science call science. They include things like being provisional and progressive, being testable and repeatable, observable or empirical, falsifiable, experimental, or the ability to manipulate variables. And then finally, from the sociologists of science, they say there's something unique about the scientific community that contributes to science. So those are the features. So how are we going to define science? Again, it seems simple question with a very difficult answer. Philosophers of science would say that science is a discipline. That's an activity. It studies the structure and behavior of the physical and natural world through observation and experiment. So any discipline is going to have several components, including methods, knowledge, and a community of people who practice it. We'll come back to this and we'll start to ask ourselves whether follow the science can follow a discipline, or when people say follow the science, are they really talking about something else? So if we can't use specific criteria to differentiate science from non-science, how do we decide what's scientific? Overall, we basically reach a consensus, and philosophers of science have reached a consensus about the several central cases like biology and physics. They've also reached a consensus about things that aren't scientific, like playing the violin or musical composition. In between these continuum, disagreement reigns. So do you consider psychology a science? Do you consider economics a science? Do you consider sociology? How about anthropology? The Stanford Anthropology Department was actually split for 9 years over a feud of whether they should be considered scientific or humanities, and whether their method should closely relate to biology or to humanities disciplines. And I love what nerds fight about. I'm always here for the drama. But the fact is that calling something science is very rhetorically charged. People are arguing about this because they know that if they can say we do science, that people will believe them, or it gives some sort of validity. Over time, people have started asking, why does the label give anyone any more validity if there's not specific criteria? What we really should do is take a deep dive into the methodology and look at the overall evidence for your claim, whether that's looking at interviews, whether that's looking at mathematical modeling, or whether it's looking at a cell culture. We also know that things like cell culture and animal models that we use in science have very practical limitations, like gene changes when you take a cell and put it into a culture, or drug efficacy when you take drugs that work in humans and put them into rats. So over time, people have grouped scientific disciplines into the natural sciences and the social sciences. And those are likely things that you've heard about, but just maybe not thought about it like this before. So now it's important to distinguish science from other things that people commonly mean when they say science. First, differentiating it from reason, nature, and fact. So this little scientist guy, he looks smart. I think if he wants to study the natural world or nature, he uses his reason, which is basically his intellectual capacity to think and manipulate information. And using his reason, he applies the discipline of science to study nature or the natural world. And so here we say that nature's not the same as science, although science is a tool to study nature. Reason is not the same as science because reason can also be used to talk about history, philosophy, morality, and ethics. And then once you've reached something that you think is approximating a fact, it goes back to the scientific community to be deliberated. And over time, it might be accepted into the scientific canon as a scientific fact. But we know there's facts not scientific, right? Like historical facts or what we would consider to be moral truths. And so when you say this is a fact, what you're really meaning is it's a fact of the natural world being approximated by science. So science is a discipline or a study. It contains a methodology, a body of knowledge, and community, but it's not synonymous with reason, nature, fact, or an opinion poll of scientists. And when you say scientific consensus, some people mean it's what the scientists believe, but really what they should be saying is that the overwhelming scientific evidence says this. It's not necessarily the opinions of the scientists themselves. Moreover, science is not necessarily the application of science to a practical problem. Science is not the same as technology, although science helps us form technology. Science is not the same as engineering because people who work on roads as an engineer are not the same as people who operate an engineering lab. And medicine is not the same as science because most physicians are not physician scientists. There's a difference between applying science to solve a problem and gathering information through science. One is an information gathering and the other is applying that information. And then finally, we look to the field of epistemology, which tells us the limits and scopes of what we can and can't know, what science can and can't tell us. Science is a method by which we answer empirical questions, but science doesn't tell us whether a decision is right or wrong. And that's why it's important to differentiate science from reason, because reason integrates different types of knowledge and tries to make arguments for what is right and wrong. And science is one tool by which we get facts that we can start to argue for right and wrong decisions. So a main concept of science is that there's a gap between scientific knowledge and that which is right and wrong or appropriate action. Science tells us or helps us work out how confident we are in a hypothesis, but it doesn't tell us what to do given that hypothesis. It tells us descriptive information, but it doesn't give us prescriptive or normative information about how we should act. It tells us what is in the natural world, but not what ought to be. and it tells us what to believe about a hypothesis, but it doesn't tell us what to do in light of that hypothesis. Leading philosopher of science, Peter Godfrey Smith, in his premier textbook, Theory and Reality, summarized this dilemma by saying, working out what we think is true is one kind of input to decisions about what to do, along with the risks and benefits that derive from different actions. What I am against, especially in the scientific context, is views that deliberately mix the two together, working out what to believe and working out what to do. So as we defined science, we saw that science is actually a theoretically explanatory discipline that attempts to study the physical and material world through observation and experiment. It's a discipline with methods, a body of knowledge, and community. At that point, you have to stop and ask, when they say follow the science, are you telling people to follow a discipline, a methodology of studying the world, or are you talking about something different? We realize that science is a broad term with no clear demarcation, although the features include things like being provisional, repeatable, empirical, falsifiable, and experimental. Specific science, remember that spectrum, have specific unique strengths and weaknesses. And really, science isn't necessarily one thing, but it's a broad spectrum of different human activities to acquire information. Science is different from reason, fact, nature, and the opinion of scientists. And when we look at the field of epistemology, science is descriptive, not prescriptive. It tells us what is, but not what ought to be. And it tells us something about knowledge, but not about what's the best action. So this is where we reach my first point, that follow the science conflates scientific knowledge is with non-scientific claims about appropriate action ought. So we said that science, or the scientific disciplines, are one type of input into decisions about what's right or wrong when we talk about policy. So let's list some components of COVID-19 related policy. They include things like epidemiology, virology, medicine, economics, psychology and sociology, special interests that influence public policy always, law and history, morality and ethics, risk tolerance, and values and priorities. And we'll talk about each of these briefly and how they come together. So there's no denying that science is one of, by far, the most important tools that we have to respond to a pandemic. Epidemiology was very important early on in doing mathematical modeling and predicting, actually forming a scientific hypothesis about what would happen in the human population with COVID, with and without public health measures. It's a way to acquire information without it actually playing out. Widespread epidemiological testing gave us accurate knowledge of morbidity and mortality, which can then inform our risk tolerance and modification of behavior. It lets us know what our infection risk is, and widespread contact tracing, again, helps us know how to modify our behavior to prevent the spread of COVID. Virology, through basic science, helps us understand the molecular composition of COVID-19. Historically, basic science led to the understanding of mRNA and the eventual utilization of that as an immunization. Virology helps us understand viral load and how we know when we're infectious or not. It helps us understand how it's transmitted. It helps us understand variants as we continue to move more towards an endemic phase of COVID-19, and it helps us to understand immunity. So all of these can be translated as practical inputs into a decision about policy or personal behavior modification. Then we have medicine. Medicine and the interaction between translational science and industry gave us tools like vaccines, antiviral therapy, monoclonal antibody, as well as ventilators. And our ability to treat COVID-19 obviously is one input into how we decide about policy and behavior modification. Then there's questions about hospital space and overwhelming the system, personal protective equipment, both the availability and the efficacy, and then the unintended consequences of human health for all types of policy decisions. Then we turn to economics. And when you look in the literature, there's actually a widespread opinion and verbiage used for these, both among people who would be considered Republican and Democrat or left and right politically. People talk about the economy or future economic burden, borrowing from their children. People talk about the economic determinants of health because income and wealth can impact your health. They talk about furthering the divide of economic equality, and they talk about the impact, the disparate impact on the poor of certain policy decisions. Turn to psychology and sociology and realize that these are two fields that can tell us a lot about compliance and reasons for compliance and barriers for compliance in terms of people's lived experience and in terms of their beliefs and risk tolerance, which we'll talk about a little bit. Sociologists have made a strong claim that a lot of methods of contract tracing, including using cell phones, is actually derived from sociologic methods. So it's an overlap between epidemiology and sociology. And then, of course, as we've seen in our pediatric patients, there's the unintended social and psychological consequences as we essentially change the fabric of society and normal interactions through our policies. There's special interests like there are with every policy. And so you have people like manufacturing companies, asking for particular like grants or subsidies, pharmaceutical companies, government officials with conflicts of interests, and then workers unions advocating for one particular action over the other. There's law and history. And of course, political decisions aren't being made in isolation. They have to be made with some sort of an understanding of what's culturally appropriate, like a regional or federal lockdown. Then you have to enforce the lockdown. And that might mean locking pastors or priests or religious leaders up for holding religious services. It might mean forcibly shutting down businesses if you truly want to enforce those rules. And so sometimes making the rule and actually enforcing the rule are two separate things that policymakers have to decide. There's historical precedent. So this is an unprecedented situation, but you can look at past pandemics and see how people responded and whether this would be somewhat appropriate given those responses. Then there's future implications. Policymakers will ask themselves, well, maybe I should wield this power in this situation. But what if someone I disagree with says the same thing and wields the same power in a different situation? And that's something that people have to think about when they're making policy. There's morality and ethics, and at times different ethical and moral principles might, I'm not saying they always do, but they might interact. Let's say that people say I'm a utilitarianist and I believe we should do what's most good for most amount of people. But then someone says, I think we should prioritize trying to prevent illness in vulnerable populations. You could see where there could potentially be give and take in those two things. We talk a lot about the right and wrong decision, and most people might think it means more or less deaths, but oftentimes it's a morally informed decision talking about it's morally right to prevent deaths. It's morally wrong to infringe upon my freedom. So we're really talking about moral issues. And then there's the question of moral responsibility. Are you morally responsible for giving someone else a virus? How about if you're asymptomatic versus symptomatic? These are the discussions that people have when they think about morality and ethics pertaining to this topic. We return once again to psychology to talk about risk tolerance. And risk tolerance can explain how two very reasonable people, based on their baseline psychology and their sort of social milieu and economic incentive, might respond differently. Now, this assumes a shared fact. And so risk tolerance is not saying COVID's not real, there's no chance of dying, therefore I do this. But even for people who have shared facts, there can be very reasonable discrepancies based on their situations. So let's say we have a 35-year-old mother of one in a dual physician family with a household income of $600,000. She probably has an internal locus of control, meaning she's used to controlling her environment. COVID in her mind is the biggest threat to her family's existence. COVID is also a big threat to her at her job because she takes care of patients who has COVID, and she wants to reduce the burden of that as much as possible. If her kid gets COVID or if they shut down their school, she's very well educated. She's able to pay for tutors, private school, or just educate her child herself. Now compare this to a 35-year-old single mother of 3 with an annual income below the median. She has things working against her favor. First of all, she has an external locus of control potentially, where she's used to things during her daily life threatening her more than she perceives COVID to be. Like, for example, paying for her electricity to stay on, or paying for propane so she can heat her house in the middle of the winter. She has a very challenging time balancing making enough money to pay for her children's existence. And so if her kids have to stay home from school, she has to stay home from work. If she doesn't have group health insurance provided by her work, then she has to figure out a way to pay for that. And if she can't pay for that, then of course you can see how this spirals, and you could see how her incentive would be, I'm not going to get him tested. He needs to go to school so I can go to work. We had a 55-year-old male accountant. Let's just say this accountant went into accounting because he knew he was smart. He knew he could get a good job. He knew it was safe. He has a retirement account that's based on the S&P 500. He gets group health insurance that's $8,000 per year, and he can work from home and continue to get his benefits and his income. Now let's talk about a restaurant owner. This person's a small business owner who has leveraged everything they own into starting a business. Why? Because they are willing to assume a very high risk tolerance. They want to be a business owner because they really believe in freedom. His group of health insurance he doesn't have group health insurance. He pays for it out of pocket. It's $20,000 per year. He also has 15 employees. None of them have group health insurance that he has to think about when he's trying to decide whether to open or close his business. And his thought is, don't close me. Just don't come in if you're worried about getting COVID. And that's his response, because he's worried about losing not only his business, but his entire retirement account, which is essentially leverage into his business. Then we have an 80-year-old female with COPD who's very worried about dying. And she says, don't visit me. I'll stay in touch over the phone. I'll go on social media, and I'll, take very low risk sorts of encounters to keep myself busy. What about an 80-year-old female with COPD who says, my religious devotion is the single most important thing to my life. I will not stop going to church. My family is the other most important thing in my life. They will visit me. I'll tell them, don't wear a mask because I want to see your face. I could die in the next 5 years. I'd rather die from COVID than die at age 90 with dementia. And those seem to be reasonable alternatives as long as she assumes the risk. They seem to be somewhat reasonable positions for people to take. It could be that an 80-year-old would rather die from COVID infection than something else that could be coming down the turnpike. I don't know, I'm not arguing for or against, but you can see how reasonable people with the same set of facts might reach a different disagreement about what they want to do personally or what they might project onto policy. So next we have values and priorities. And this is where everything got so contentious during COVID. So we're just going to do a broad outline. So what do we do about schools? What do we do about places of worship? How do we differentiate essential versus non-essential workers? How do we protect healthcare workers, which obviously hits close to home for a lot of us? What do we do about hospital visitors? Is it worth risking the chance of more people dying or getting sick so that people can be with people while they're dying or giving birth? How do you go about balancing that? Do we even know what the risk is? How do we balance seeing our family versus protecting family? Can you justify protests in the name of certain injustices during the pandemic because you say that's a higher public health priority than COVID? How do you balance freedom versus public health, which obviously changes based on the culture you grew up in the country? And we know that because different countries had significantly different compliances based on what their cultural background is. These are all wicked or tragic problems. Tragic in the Greek sense that there's no obviously right answer and that any decision is likely to have a bad outcome of some sort. And they're wicked in the sense that they have a horrible trade-off, that these values and priorities are very difficult to balance. There's no obviously right thing. You can make a very serious case that there are, a lot of gray. So while public policy tells us follow the science, or while follow the science tells us that public policy works like this, that science makes obvious or dictates public policy, that public policy should act according to science. What you really see is a bunch of different inputs. The scientific inputs are not just science, they're different disciplines with strengths and weaknesses like epidemiology and virology. There's things like medicine, economics, psychology, and sociology, and special interests. They are all being viewed through some sort of value system and some sort of risk tolerance, which is embedded in economic incentive and psychology and culture. And when you output some sort of public policy, it has to be within the confines of the law and what's considered moral or ethically reasonable. So it's much more complicated than you might think. One ethicist summarized this entire debate about, whether science is one means of knowing what is right to do or whether it tells us what to do. And he says, politicians and regulators in the US have frequently employed the term following the science to describe the process by which they've decided on coercive containment measures. Coercive being by definition something that's mandated by the government that you could get fined or thrown in jail for. But any claim that such measures are simply conclusions from science are not merely misleading, it is straightforwardly false. Science never determines what is morally or politically optimal, and it never tells us what to do. To the contrary, while science provides facts that are relevant to moral political decisions, these decisions always hinge on moral political values and how these values are weighed and prioritized one against another. A reasonable person who highly values freedom and is willing to face a high degree of risk before relinquishing it will choose a different way of responding to dangerous threats than a reasonable person who puts safety first, even when both persons recognize the same array of scientific facts, which is a big if, because we have to be talking about the same facts to know what the risks and benefits are. To present a single alternative as the only scientific approach ignores this reality. So to summarize objective 2, we saw that using the term scientific really isn't specific, and you don't talk about what scientific input you're discussing. Science is based on many inputs, or policy is based on many inputs, not science alone. Risk tolerance can explain some reasonable variation in opinion and behavior, especially when we're talking about the same facts. Policy ultimately must adjudicate trade-offs and competing values, which is not the job of science. And follow the science, as a rhetorical phrase, fails to do the following: identify specific scientific claims and recognize the multidisciplinary, integrative, and democratic nature of public policy. So finally, let's examine the impact of follow the science on views of science and public policy. To do this, I performed a systematic review of the literature, Follow the Science plus COVID-19, that included discussions on policy. There were 19 articles. They were published in a broad array of journals, including political science and public health journals, social science, medical journals, ethics, philosophy, economics, and communication. Most were essays or editorials, but some were interview or survey studies that attempted to understand people's understanding of this phrase or their understanding of science. And when you looked at the opinions espoused within these articles, the overwhelming majority were critical, with one being neutral and three being surveys of like what people thought. And so they didn't really provide a definitive opinion. One paper that was very interesting, and this will change a little bit or confirm kind of what I'm talking about, was in the BMJ Global Health. It looked at scientific advisors in 5 European countries and their experience. And here you can see that they really do not like the idea of follow the science and its associated rhetoric. So one of the themes that came out was the difficulty balancing the nature of the relationship between scientists and government. And these are scientific advisors informing policymakers. At some point in March, our prime minister said, "I do what the name of the scientific advisory board says." I found that a very unpleasant comment because it implies that you are directly responsible for the policy pursued, and that is not the case. It is simply a political choice, and we only give advice, so they should take it as such and not hide behind that advice. Another theme arose was making the sense of the boundaries of their roles as a scientific advisor. This advisor said, "And the politicians have to make the final decision because they see the whole picture. We must be very careful as experts not to become politicians and not to cross that line." And then finally, they discussed the difficulty of finding themselves in the public eye. And contrary to popular belief, scientific advisors on the whole do not want to be in the public eye. And you might think, really? If you've met a scientist, you know, those people, they don't want to be seen by anyone. They just want. The perception of responsibility is entirely wrong because political decisions always take science as one of their inputs. While sometimes the public perceives political decisions to be entirely driven by scientific information, which is just not the case, because of the picture that the media creates. It's really a narrative in the media. We know that in the first several months of the pandemic, public trust in scientific expertise increased. But over the last year or so, the US public confidence in science and medical scientists has decreased, along with decrease in many major institutions, including the military. We also know that people who think scientists are biased or who change their results based on what they want to see are much less likely to follow public health recommendations, like wearing a mask in public. This is where we come to the issue of trust. And does the rhetoric of follow the science help people trust scientific expertise? As the COVID-19 pandemic shows us, it's a distinct kind of trust in experts when experts not only provide information and data, but also play a role in the formation of science-led policy. Again, they're not just saying what is, but they're saying what ought to be, and people are being asked to, believe that. When public policy claims to follow the science, citizens are asked not just to believe what they are told, but to follow expert recommendations. And it's a different kind of trust to be told this is a fact versus this is what you do in light of that fact. Invoking the science and masking the political nature of pandemic response may well contribute to further polarizing trust in both science and governance along socially differentiated lines. Government responses that implore citizens to follow the science without accounting for the socio-culturally structured experiences of the pandemic risk exacerbating a socio-epistemic disjuncture in which conspiracies flourish. So the politicization of technical experts happens in a few easy steps. First, the public notices that people are using this rhetoric. And as the scientific advisor said, it's something created by the media in their opinion. They realize that people are starting to say that science is something that tells them how to live, not something that tells them how the world is. Scientists increasingly become viewed as politicians, not technical experts. And then people start saying, well, I don't like what you're telling me about how to live, so I'm not going to listen to what you tell me about the nature, the natural facts. And then through this, as the scientific advisors bemoaned, politicians are able to avoid responsibility and say, I'm just doing what the scientific advisor said. As such, I have some proposed knowledge or language to use when you're talking about scientific technical information in this context, not necessarily if you're talking to grandma and grandma. So the first line is from Jay Varma, who published this in the Atlantic, and he's a scientific advisor in the United States, who again was very against this term follow the science. He said rather than saying follow the science, he would say, if the most important policy priority is to reduce COVID-19 illness and death as much as possible, then the scientific evidence indicates the city should do this. So he used a conditional statement saying if, then. He didn't step into other domains saying this is the obviously right choice. He said, if you want to reduce COVID-19 morbidity and mortality, then this would be the next choice. Things I think he could do better. He said scientific evidence. What evidence is he talking about? What are the strengths and weaknesses of that evidence? And then he said the city should do this, but he wouldn't even need to provide that recommendation. He could just provide the facts of if the city does this, this happens. The city does this, this happens based on this data. So this is what I would propose. I would say epidemiologic models, which gives you an idea where this knowledge is coming from, predict that without this intervention, the outcome will be this many deaths. With this intervention, we predict the outcome will be this many deaths. There are key assumptions of this model, which include a mortality risk of blank and a transmission rate of blank. Historically, the accuracy of similar models is blank, and reasonable predicting models predict this. And here you get a sense for a lot about the information that's being conveyed, and especially key assumptions. Like early on in the pandemic, where we didn't have widespread testing, we didn't know, is the mortality rate 20% or is it actually 1% if we do widespread testing? And that's important to know when you're doing your modeling. When you question follow the science, you should ask, is science epistemologically capable of mandating behavior, or is it a way that we answer an empirical question which can be used to inform our behavior using reason? What type of science discipline and methodology is being referenced? What are the strengths and weaknesses? To what extent has a scientific theory or observation been combined with non-scientific ideologies or value assumptions, which might not be wrong, but it's important to parse them apart so you can debate about each of these individually. Can we disentangle the science from the policy? Can we agree with one of them, the science or the policy, but not the other? And what other non-scientific inputs are needed to decide? What are the competing factors? What's the trade-off? So to summarize, and I know we're pushing up against time, but science is a discipline with methods, a body of knowledge and community. It's a broad term with no clear demarcation, but it has features of provisionality, it's repeatable, empirical, falsifiable, and experimental. Specific scientists have unique strengths and weaknesses, and that's why it's important to identify where knowledge is specifically coming from. Science is not the same as reason, fact, nature, or the opinion of scientists, although it's commonly used in that way in our everyday vernacular. And from an epistemological standpoint, science is descriptive, not prescriptive. It tells us what is, not what is ought, and it can tell us something about knowledge, but it cannot tell us whether it's the right or wrong action. Science is non-specific. Policy is based on many different inputs, not science alone. Risk tolerance can explain some variation in opinion and behavior, especially if you're talking about the same set of facts. And policy must adjudicate trade-offs and competing values, which is not the domain of science. Finally, we saw that science, follow the science and its associated rhetoric, is resented by scientific advisors, the people who do this for a living. It provides an escape for political responsibility. It politicizes technical knowledge. And so we should ask, what assumptions or values are combined with scientific claims? Improved technical communication includes the discipline and the methodology, which can summarize historical weaknesses and strengths. It can identify key assumptions that provide us that knowledge. It uses conditional if-then statements or refrains from policy recommendations altogether. And it can review reasonable alternatives. So in the beginning, I said I had 3 statements, and I hope you see some evidence pointed towards these now, that follow the science conflates scientific knowledge with non-scientific claims about appropriate action. Follow the science and its associated rhetoric fails to identify specific scientific claims, and it fails to recognize the multidisciplinary, integrative, and democratic nature of public policy. And follow the science risks negatively impacting the public perception of science and public health. And throughout this talk, we saw that philosophers of science, whose job it is to understand what science is, were skeptical of follow the science. And scientific advisors were skeptical of follow the science. And so if you don't take my word for it, hopefully you can take their word.